Okay, so I hope everyone enjoyed. I'll take questions now if you want to go ahead and put them in the Q&A or the chat box, and I think we have one. So, do you think HRT helps with extra weight once gained due to menopause? So, certainly, as we talked about, menopause will cause this change in body composition. So it's the central adiposity. So women don't necessarily gain a ton of weight, but they start to complain or notice changes in their body composition, and that's really twofold. So the first part is, yes, the lack of estrogen can affect our metabolism, but also as we age, we tend to lose muscle mass, and that's the other thing. So I know there's been several amazing talks over the weekend that have really talked about diet, exercise, but menopausal hormone therapy is not going to make you lose weight. If anything, it's probably going to help stabilize the metabolism slightly, and it will probably make you feel better. So a lot of times, if you have the fatigue or the decreased energy associated with menopausal symptoms or the hot flashes and the night sweats, that kind of goes away with it. So you might feel more inclined to, exercise more. What I tell a lot of my menopausal patients as they kind of struggle with weight changes during this time is, to kind of echo the sentiments of a lot of other docs you might have heard this weekend is really increase it. It's really about diet. So as we age, we really need to be more cognizant about what we eat. I can't stress enough the importance of whole grains, fruits, vegetables, lean proteins if you do eat meat or animal products, and then making sure that we really cut out a lot of processed foods and refined sugars. Those are really the big culprits. And then with that, a big thing about exercise is really increasing strength training. So like I mentioned, as our metabolism slows down and we lose muscle mass, we really want to do as much as we can to really build that muscle mass up. So people are always worried about, or always, scared to go to the gym and lift heavy weights. But the reality is you're not going to become a bodybuilder overnight. Things even like yoga or Pilates or using your own body weight are even really, really helpful to kind of help build up a lean body mass. There's actually been a lot of data that looks at yoga, regular yoga, and regular Pilates as it relates to bone density. So we had talked a little bit about in that video how you can lose bone really rapidly in menopause. So I always encourage people, even if, with COVID, it's quarantine, I'm a big Orange Theory goer, like Ruhi mentioned, and it's been difficult to find new things that we can do. And, I pretty much converted my dining room into like a makeshift home gym. So I figured if nobody comes over for the rest of the year, it can kind of stay in as is, but doing whatever you can. So even if it's a 15-minute video you can find for free on YouTube, I encourage people to do that, because a little bit, all of that will add up, and a little really goes a long way. Okay, so another question, can some symptoms of thyroid issues be similar to menopausal symptoms? And the answer is yes, 100%. So when I see a patient that comes to my office and is concerned about menopausal symptoms, the first thing I'm going to ask her is what is her bleeding pattern like? So is she still getting menstrual periods? Because again, that definition is really 12 consecutive months without a period. You can have, skipped periods here and there. You can have normal periods, but still exhibit a lot of those similar symptoms. So part of my routine panel is to always check a thyroid. And interestingly, patients that have things like Hashimoto's, which is an autoimmune condition that attacks the thyroid, so it's a form of low thyroid or hypothyroidism, actually tend to have worsening menopausal symptoms, and actually tend to get menopause a little bit earlier. So they tend to fall into that early menopause category between 40 to 45. So yes, a lot of those similarities are there. I definitely think, if you're going to get lab work done, a thyroid definitely needs to be involved in that panel just to make sure we're ruling out other potential causes. Okay, let's see. So you prescribe estrogen for everyone going through menopause for cardiovascular disease and bone health protection? Not necessarily. I am a big advocate of hormone therapy, but again, it's not for every single person. The bone health aspect, if somebody is maybe high risk, and they are symptomatic, or they're having, a lot of these symptoms, and they're coming to me with a really poor quality of life and they're really suffering, yeah, it could be an option. For women that maybe go through surgical menopause, so maybe they are a little bit younger, so maybe they're late 30s, early 40s, and for whatever medical reason, if it's benign, meaning non-cancerous, and they have their ovaries removed, hormone therapy, I think, has a really profound impact on those patients in terms of their risk for chronic disease. So again, for a woman, generally speaking, your body is meant to kind of have a stable level of hormones till your, late 40s, early 50s, depending on when you kind of go through menopause. If it happens earlier, it can actually accelerate a lot of chronic disease. So again, in my younger patients that maybe go through it, and that have symptoms that actually have a need for it, then yeah, we talk about the risks and benefits, and it can certainly be an option. But not every single person that walks into my door gets a prescription for hormone therapy if they're not a good candidate. Let's see, I think I have another one. I've been taking low-estrin, and all of a sudden I stopped bleeding after many years of being on it. How would I know if this is normal? OBGYN said this can happen on low-estrin or the beginning of menopause. I'm 46 and a half years old. So that is a little, okay. So one, it would be, do you have any clinical symptoms of menopause that we had talked about specifically in that week that you're supposed to be bleeding? The other thing is even being on any kind of birth control can certainly induce amenorrhea or a lack of a period, and that can sometimes be very normal. Generally speaking, patients who are in their late 40s, if they're a candidate for it and they're worried about pregnancy, a low-dose birth control pill might be how we actually treat perimenopause. So you might just be on a form of treatment. I mean, again, this would have, I'm not going to give medical advice, but we'd have to kind of go through what your chart was, but you can always, it's difficult to get hormone levels while you're on a birth control pill because it's not always accurate. So I would talk to your doctor just make sure that you're ruling out other causes of not bleeding and not just attributing it strictly to the birth control pill.